Assalamualaikum and good day from Al-Shraq Hospital, Fujairah. So I am Dr. Simon Chummar, specialist maxillofacial surgeon working in UAE for the past 17 years. And I have been working in some of the reputed good hospitals in UAE. Today I am back with some more topics in my specialty area. Today I will be talking on management of wisdom teeth. So let's see what is an impacted teeth or a wisdom teeth. In Arabic it is called akal durus. So let us see some factors what lead to impaction, and today I will discuss in detail what are the treatment plan, what are the management strategies for this wisdom tooth. So impacted teeth, as I told you, in Arabic it is called akal durus. It comes usually after 17 years, 18 years, usually it comes into the mouth. It's the last teeth to erupt or come into the mouth. So what are the problems with this wisdom teeth? The problem with the wisdom teeth is, as you know, the jaw is almost developed by the age of 18 years, and when the wisdom teeth tries to come, there is no space for it. Second thing is, our forefathers who were 1000 years back, they had a bigger jaw. So that is to eat more food at that point of time, more raw food at that time. So now we eat more refined food. So our jaw size has reduced over a period of time. So by the time when the wisdom teeth comes, like say around 18 years, there is no space for the teeth to come. So it comes in, it doesn't come out properly, and it it leads to this impaction or improper eruption into the mouth and not into proper occlusion. So as I told you about this wisdom teeth, that these wisdom teeth are not the only teeth which are impacted. There are other teeth also which are in, any teeth for that matter can get impacted, especially when the primary teeth or the milk teeth don't go off early or doesn't fall off in correct time. At that time there is no space for the permanent teeth to erupt, and this leads to impaction of that particular teeth. So one thing is, other things like systemic problems, rickets, dysplasias, these all, in those cases also systemic diseases or certain systemic diseases we get impacted teeth also. So let's come to, so these are some of the causes of the impacted teeth. Sometimes infection also plays a major role in causing impaction. Cyst development around the tooth also leads to impaction of the teeth. So it's not only the wisdom teeth or the teeth which comes at 18 years is impacted. There are other teeth also. Which gets impacted. So as I told you, the causes of impaction of the teeth I mentioned to you. Now let's see what are the problems associated with this wisdom teeth or impacted teeth. The first problem is, when the wisdom teeth comes into the mouth, it may come only partially. So when it comes out partially, food gets impacted in between the teeth and the gums, and it leads to chronic infection. So, or pericoronitis, what we call as, which may lead into severe infection, swelling of the face on that side, maybe on the right or maybe on the left side, and space infection later on, if you don't get it treated, may lead to submandibular space infections, which may require hospital admission and IV antibiotics and admission also, and may require also drainage of the abscess with removal of the wisdom teeth. So that is what is one of the most common problem or challenging problem with this impacted wisdom teeth. There are other problems also with this impacted wisdom teeth, that is cyst formation or resorption of the neighboring tooth by directly impinging on the roots of the neighboring tooth. So in these cases we suggest for removal of the impacted teeth. So is it necessary always to remove the impacted teeth? No. Sometimes when they are deeply seated and it may be near to vital structures like the blood vessels and the nerves or the maxillary antrum, where it is lying harmlessly, there is no cystic changes or no resorption of the root of the neighboring tooth, and it is very high, deeply impacted and fully surrounded by bone, then we can leave the impacted tooth as such. Only you need to observe it. If suddenly it changes, like the cystic changes appear around the tooth, then only you need to remove, or there may be some pus discharge from the tooth, then only we need to think of removal of such teeth. Otherwise, deeply impacted teeth which is not creating any problem, we don't advise for removal. So let's see. So these are some of the problems of impacted teeth which I discussed, and root resorption and caries of the neighboring tooth because of food impactions are the things which are the problems created by these impacted teeth. Then let's come to some other problems of impacted teeth. Is it always necessary? As I told you, not only the wisdom teeth is impacted, the canines are also impacted, the premolars are also impacted. So one option is what are the treatment options. Now let's come to some of the treatment options. One of the treatment options, what you can, we suggest the patient is, if the teeth can be brought into occlusion, we do orthodontic traction and pull the teeth out into correct occlusion. If it cannot be removed, if it cannot be brought into correct occlusion, if the teeth cannot be brought into correct occlusion, then the solution is only to remove the teeth. So for removal of the teeth, what is the best time to remove the tooth? We always suggest during the teenage period, or after 18 years or 19 years, when the tooth is about to erupt. That is the right time to remove it, because it is less traumatic at that time, and it is less traumatic and easier to remove, and the patient has lesser discomfort. As you grow older, the bone becomes more sclerotic and more difficult to heal. So when you remove a wisdom teeth at an older age, it takes more time to heal, more discomfort for the patient, and when you are young, it heals very faster. So anyway, if the teeth is not coming out in correct position, it is better to remove it. The earlier the better. So that is one of the treatment options. Now, how do we remove the wisdom teeth? Usually the wisdom teeth can be removed under plain local anesthesia, and other way of removing is under local with sedation, and under general anesthesia when we have multiple wisdom teeth to remove, like 4 wisdom teeth if you need to remove, it is done under general anesthesia, or as a daycare procedure. It is always as a daycare procedure. Morning you can come, and by evening you should be able to go back home after removal of all the 4 wisdom teeth. Then how we remove it? Usually the thing is, under local anesthesia, we first give local anesthesia, wait for some time, for 5 to 10 minutes for the local anesthetic to work. After that, we open the gum, because we need to create a space there. So we open the gum, and after opening the gum, we try to remove little bit of bone around the tooth to make the tooth loose. So we may use a small surgical drill with water coming in the mouth to loosen the teeth from the bone. So once we loosen the teeth from the bone, we may have to section the tooth. We may section the tooth and remove in pieces, because the wisdom teeth, as I told you, may not be in correct position, and we have to remove it as automatically as possible. So we cut, we section the tooth, and then we can remove it. So that after we remove it, we just clean that area with saline, and we put stitches which get dissolved in 3 to 4 weeks time. So what are the and usually what are the complications or problems associated with the wisdom teeth removal? Maybe some bleeding may be there after removal of the teeth, but usually it stops after 24 hours. Then there are other problems which are specific to wisdom teeth, the proximity of the nerve, then the maxillary sinus, so that we have to evaluate on the radiograph. Sometimes we take a 3D scan to see the position of the nerve before we remove the wisdom teeth. So these all things can be explained individual, for it may be individual case based. So once we take the X-ray, we take the CT scan, and then only we plan for the removal of the wisdom teeth. So this is how it is the wisdom teeth we remove the wisdom teeth. Second, as I told you, sometimes we don't remove the all the impacted teeth, because it may like the canines, which will require pulling it out into occlusion by an orthodontist. So it will be a joint discussion, joint teamwork. We have a discussion with our orthodontist to whether it can be brought into occlusion. If it can be brought into occlusion, the surgeon opens the gum or opens the gum, removes little bit of bone on top of it, and then the same orthodontic brackets or the metal or plastic brackets are fixed onto the teeth, and slowly the orthodontist gives traction to bring the teeth into correct position. So this is how the impacted other impacted teeth are managed. Sometimes impacted teeth may give rise to a dentigerous cyst. Usually give rise to a dentigerous cyst. In that case, when we may try to do a malsuturization and let the teeth erupt into correct occlusion, or we may remove the cyst along with the tooth. So that is depending on how big is the cyst, how difficult it is to remove the teeth. We plan accordingly for general anesthesia or sedation. So these are the few things what I would like to discuss with regarding impacted teeth. Then how do you take care after after removal of the wisdom teeth? After we remove the wisdom teeth, there may be, as I told you, there may be a little bit of bleeding from the gums for first 24 hours. So what you need to do is apply ice on the face for every 15 minutes for the first 24 hours. Again after 1 hour for 15 minutes, then again after 1 hour for 15 minutes till night, late night. Can we eat after removal of the wisdom teeth? Yes, of course you can eat. Only thing is that you have to eat puree diet for 1 day, 1 or 2, maximum 2 days, cold and puree diet like ice cream, juice, custard, like that, cold and soft and puree things you can have. Plus you will be given antibiotics and painkillers after, and a mouthwash also after the procedure, which you need to take it properly so that you will have very less discomfort. Will there be swelling? Yes, there will be swelling on the face for 2 to 3 days. Usually after third day it starts reducing. So we can give sick leave, or for those people who are working, for 2 to 3 days after we remove the wisdom teeth. Swelling gradually decreases. Will I find difficulty in eating the food? Yes, your mouth opening may be restricted, or your mouth may not open may not open fully for at least 2 or 3 days. By the time the swelling subsides, your mouth should be opening fully, and maybe first day you can eat with a spoon, or a little small portions you can chew after first day, or first day you can take sips of of juice, cold juice. So that's how it is managed. And second thing is, you need to apply ice on the face after we remove the wisdom teeth. That is most important. Plus the antibiotics and painkillers you need to start after half an hour or 1 hour after we remove the teeth, because the effect of local anesthesia decreases, and then you may start getting the pain. So in order to avoid that problem, we always advise the patient to take the medications as soon as they go home, remove the cotton, take some ice cream, juice, or cold things, and take the tablets, painkillers and the antibiotics. So when the anesthesia effect goes, there is no pain and you are comfortable. Continue applying with the ice, and there shouldn't be any problem. And after 24 hours, the next day or after 24 hours, you can start with the mouthwash. Don't gargle vigorously, because if you gargle vigorously, then the stitch may open up and food may get stuck there. So just hold it in the mouthwash, and just spit it out gently. And alternatively, you can use warm saline rinses, or take some warm water, put some salt in it, and just hold it in the mouth and spit it out. And after 24 hours, you can start the normal activities. Avoid exercises or straining exercises, or like going to the gym, or into the swimming, or strenuous exercises for 2 to 3 days. So these are the points which I wanted to convey to the people. And all this facility is available at Al-Shraq Hospital, Fujairah. You are most welcome, and you will be in a safe hands in Al-Shraq Fujairah Hospital. Thank you.